Hey everyone, and welcome to the Deep Dive. Today we're heading all the way to India, to the state of Chhattisgarh,
Chhattisgarh.
to take a deep dive into their healthcare system.
Yeah.
And, listeners might be interested in this for all sorts of reasons.
Sure.
Maybe they're planning a trip, maybe they have family there, or maybe they just find the unique challenges of providing healthcare in this particular state fascinating.
Absolutely.
But Chhattisgarh is one of India's youngest states.
That's right.
And it has this really complex healthcare landscape because of its large tribal population and its vast rural areas.
It does.
So in this deep dive, we're going to really try to unpack the roles that the government plays in providing healthcare.
Okay.
The different kinds of initiatives they've launched, and of course some of the hurdles they face
Good.
in providing quality care to all of their citizens.
All right. I'm excited to unpack this with you.
Yeah, me too.
Yeah.
So I was looking over these reports, and the first thing that jumped out at me was just how the government has approached this whole healthcare infrastructure.
Mm-hmm.
It seems like they've created this multi-tiered system, almost like a pyramid.
Right.
So what's the thinking behind that?
Well, it's really all about reaching everyone,
Right.
no matter where they live in the state.
Okay.
So imagine you're in like a really remote village in Chhattisgarh.
Mm-hmm.
Your journey to get specialized care
Yeah.
might involve multiple steps.
Okay.
At the very top of this pyramid, we've got these tertiary care centers.
Okay.
These are like the big guns, places like Ames Raipur.
Okay.
They're equipped to handle the most complex cases.
So those are like the top tier.
Exactly.
What comes next?
Then you have these district hospitals.
Right.
They're in the major areas
Right.
like Durg and Rajnandgaon.
Okay.
And they handle more general cases for their specific district.
So it's like a step down in terms of
exactly.
specialization, but still crucial
Yes.
for regional care.
Exactly. It's like a step-by-step system, guiding patients to the appropriate level of care.
Got it. Got it. And then as we move further down this pyramid,
Yeah.
we get to the community health centers.
The CHCs.
Yeah, CHCs and the primary health centers, or PHCs.
Yeah.
These seem like they're really the workhorses.
They are the backbone
Yeah.
of healthcare in rural and semi-urban areas.
And they're providing a wide range of basic healthcare services.
Exactly.
So they're really essential for everyday health needs.
Mhm.
But what about those living in the really, really remote villages?
Yeah.
Especially the tribal communities.
Yeah.
How does this system reach them?
So that's where the base of the pyramid comes in.
Okay.
The sub-centers and the health and wellness centers,
Okay.
these are like the frontline warriors.
Yeah.
They ensure that even the most remote areas have some access to basic healthcare.
Wow. It's a massive undertaking.
It is.
But it seems like the government is going beyond just, bricks and mortar.
Yeah.
They've launched some pretty ambitious initiatives.
Yeah, absolutely. They've recognized that in a state like Chhattisgarh, you can't just sit back and wait for people to come to the hospitals.
Yeah.
You have to take healthcare to them.
Yeah. I'm looking at this Mukhyamantri Haat-Bazaar Clinic Yojana,
Yeah.
and this sounds incredible. It's like mobile health clinics.
Healthcare on wheels.
Yeah, taking services directly to these remote villages.
Exactly. And it's not just innovative, it's also really smart.
Yeah.
They've tapped into existing social structures.
Okay.
So these mobile clinics, they're set up at these weekly markets.
Oh, wow.
These hot bazaars,
Okay.
which are places where tribal communities already gather. So
Yeah.
you're already at the market,
Yeah.
and suddenly you have access to maternal care vaccinations, even basic diagnostics.
That's brilliant.
Yeah,
It seamlessly integrates healthcare into their lives.
exactly.
And speaking of reaching people, I also read about the Sanjivani Express and the Janani Express.
Yes.
Tell me more about these.
So these are dedicated ambulance services. They're lifelines, especially for emergency and maternal health.
Yeah.
Think about it in these remote areas where access to hospitals is already a challenge.
Yeah.
Getting there quickly can literally be the difference between life and death.
Yeah. Especially in those cases of childbirth complications.
Exactly.
So it's not just about getting people to healthcare.
Yeah.
It's about getting them there quickly when every second counts.
When it matters most.
Yeah. And it sounds like they're really tackling that issue head on.
Mm-hmm.
And another thing I noticed was this focus on affordability.
Yes.
I came across the Ayushman Bharat and Dr. Kupchan Bolil Swasthya Sahyata Yojana
Yeah.
in my research. And these seem like real game changers.
They are a huge step towards universal health coverage.
Yeah, because they're aiming to provide cashless treatment for low-income families.
Yeah, essentially easing that financial burden
Yeah.
of healthcare.
And what's really interesting is that both public and private hospitals
Exactly.
are encouraged to participate.
Yeah, it's not just a government-run thing. It's a collaborative approach to making healthcare affordable.
Yeah, it's amazing how they're weaving all these elements together.
It is.
But we can't really talk about Chhattisgarh's healthcare without addressing a pretty stark reality.
Yeah,
The state has one of the highest malnutrition rates in India,
it does.
and that has to be a major focus area.
It's a huge focus for them. And they actually launched this program called Suposhan Abhiyan
Okay.
specifically to target this issue.
Oh, wow.
So it's a multi-pronged attack on malnutrition.
Okay.
They provide nutritional supplements to women and children,
Okay.
promote breastfeeding, and really keep a close eye on child growth and development.
It sounds like they're pulling out all the stops to really try to combat this.
They are.
Yeah. Are we seeing any positive results from these efforts?
We are seeing some positive results, but these challenges are really deeply entrenched,
Yeah.
and it's going to be a long road.
Okay, so we've got this incredible system in place,
Yeah.
these ambitious initiatives, and a real dedication to tackling these really complex problems.
Absolutely.
But I have a feeling it's not all smooth sailing, is it?
Well, you're right. There are definitely some serious hurdles on the ground.
Okay.
We've talked about, the government's efforts,
Yeah.
but let's kind of shift gears a little bit here
Okay.
and look at the other side of the coin,
Yeah.
the challenges that persist even with all these programs in place.
All right, lead the way. I'm ready to dive deeper
Let's do it.
into these complexities.
Okay.
So we were just talking about how Chhattisgarh's healthcare system
Yeah.
has its share of challenges.
It does.
Even with all these really amazing initiatives in place,
Mm-hmm.
kind of feels like we're zooming in on the map,
Right.
from that big picture view to the realities
Yeah.
on the ground.
Yeah.
So where should we start with these complexities?
Well, the most fundamental issue is access.
Right.
If you're living in like a remote village,
Yeah.
maybe deep in a forest or surrounded by hills, just getting to a healthcare facility can be a huge challenge.
Yeah, you're talking about those understaffed PHCs and CHCs
Exactly.
that we discussed earlier,
Yeah.
the ones that might not even have all the equipment.
Yeah, and they often lack basic facilities,
Yeah.
essential medicines.
Yeah.
And, people have to travel
Right.
really long distances to reach them.
Yeah, and I imagine the reliance on traditional medicine,
Yeah.
well, it of a part of their culture,
It is.
can sometimes complicate things.
It definitely can, because sometimes it delays them seeking
Right.
more modern treatment.
Yeah, it's a tangled web of issues.
It is.
And then there's this doctor drain
Yes.
that you mentioned earlier.
Yeah, a lot of doctors would prefer to work in cities.
Right.
Understandably.
Yeah, with better facilities and
Yeah.
more opportunities.
Yeah, and that leaves these rural areas really struggling to attract and retain
Yeah.
qualified medical professionals.
So there's this gap between where the doctors are and where they're really needed.
A huge gap.
Yeah. What's the impact of that on these rural communities?
Well, imagine, a village where the nearest doctor is like a day's journey away.
Oh, wow.
That delay can be life-threatening
Yeah,
if it's an emergency.
of course.
And it's not just about numbers either.
Okay.
The lack of specialists in district hospitals
Yeah.
is another big problem.
Okay.
So you might be able to reach a hospital, but if you need specialized care, you're back to square one facing another long journey.
It's almost like a double blow.
It is.
First the struggle to reach any kind of facility,
Mm-hmm.
and then the possibility of not even finding the specific care you need.
Exactly.
It paints a pretty stark picture.
Yeah.
You mentioned the private sector earlier.
Yeah.
Why aren't they stepping in to fill some of these gaps? You'd think there's a market opportunity there.
Well, it's not that simple.
Okay, how?
Setting up a hospital in a rural, low-income area is
Yeah.
a really tough business proposition.
Right.
The investment costs are high, and a lot of people just struggle to pay for private treatment.
Yeah, it's a vicious cycle.
It is?
Low income limits access to private care,
Right.
but then private hospitals struggle to stay afloat
Exactly.
without enough paying patients.
It's a really difficult situation.
Yeah, I'm guessing the government has tried to incentivize them somehow.
They have.
Yeah.
They offer some incentives, but honestly, they haven't been as effective
Okay.
as they could be.
So we've got accessibility issues.
Yeah.
We've got a shortage of doctors.
Right.
We've got limited private sector presence.
Right.
What other challenges are we looking at here?
Well, we can't forget the burden of disease.
Right.
We talked about malnutrition,
Mhm.
but things like malaria, tuberculosis, waterborne diseases,
Yeah.
these are all really widespread in Chhattisgarh,
And especially in those tribal areas.
particularly
Yeah.
in the tribal areas.
It sounds like a perfect storm of challenges.
It can feel that way.
Is there any hope?
Well, there's always hope.
Okay.
Every step forward, every life saved. Yeah.
Every child that gets proper nutrition,
Yeah.
it's a victory.
Yeah.
And there are some potential bright spots.
Okay, I'm all ears. Tell me about these bright spots.
Okay, well, you mentioned the private sector.
Yeah.
And while their presence is limited in rural areas, they're actually flourishing in the cities.
Okay.
Places like Raipur, Durg, Bilaspur.
Yeah.
They're seeing a surge in private hospitals,
Okay.
including specialty hospitals,
Oh, wow.
catering to more specific health needs.
So there's a demand for that private healthcare.
Definitely in those urban areas.
Oh, okay, good. At least that's something.
Yeah.
What about those telemedicine startups that we hear so much about? Are they making any inroads in Chhattisgarh?
They are. It's still early days.
Okay.
But there's definitely potential there for telemedicine to bridge the gap, especially in those remote areas.
Yeah.
Imagine, being able to consult with a specialist in a city hundreds of miles away.
Right from your village.
Right from your village. That does sound promising. But if I'm being honest, it feels a little bit like a Band-Aid solution.
Sure.
I mean, internet access isn't exactly reliable.
Oh, it's not.
In these really remote areas.
It's a huge problem.
And what about people who aren't really tech savvy?
You're raising some really important points.
Yeah.
Telemedicine isn't a cure-all.
Right.
We have to think about infrastructure challenges, digital literacy, even cultural acceptance.
Yeah.
These are all things that need to be addressed.
For telemedicine to be truly effective.
Exactly.
So it's a step in the right direction.
It is.
But it's not going to magically solve all the problems overnight.
It's not a quick fix.
I am curious, though, about those public-private partnerships.
Yeah.
The PPPs.
The PPPs.
Could those play a role here?
They absolutely could.
Okay.
We often think of PPPs for big infrastructure projects, but they can be adapted to healthcare as well.
Oh, okay.
Imagine the government working with private hospitals under the Ayushman Bharat scheme.
So the government's providing funding and infrastructure.
Right.
And then the private hospitals are bringing in their expertise and their efficiency.
Their management skills. Their technology.
And it doesn't have to be limited to just, full-fledged hospitals.
It doesn't.
We talked about mobile units, telemedicine, AI.
Right.
All these innovations could be part of that.
We could integrate those into those PPPs.
So it's about being creative, thinking outside the box.
Exactly.
We're not just replicating models.
We're adapting them to Chhattisgarh's needs.
I like it. And then let's not forget about technology.
Right.
AI-driven solutions coupled with telemedicine could really be game changers.
Huge potential there.
Yeah. Imagine AI assisting doctors in diagnosing diseases or helping with that remote patient monitoring.
Absolutely.
The possibilities are incredible. It sounds like we're standing on the brink of some really exciting advancements.
We are.
It's not just about replicating what's worked elsewhere. It's about finding those innovative solutions.
Tailored to their needs.
Yeah, that are tailored to Chhattisgarh's very specific challenges.
Absolutely.
And that brings us to a really important question. What comes next?
Yeah. How do we move forward?
Yeah, we've laid out the challenges. We've explored some potential solutions. We've hinted at the possibilities of technology. But what does a concrete plan of action actually look like?
Well, I think it requires this multi-pronged approach.
Okay.
We have to address all these interconnected challenges simultaneously.
Okay, so we've been digging deep into Chhattisgarh's healthcare system.
Yeah.
And it's clear there's no easy fix.
No magic bullet.
Right, it's this complex mix of challenges and opportunities. But I am sensing this real drive to find solutions.
Definitely.
So what are some of the key elements of this multi-pronged approach that you mentioned?
Well, for starters, we can't ignore the doctor shortage.
Yeah.
We need to figure out how to make serving in these rural areas more attractive.
Right. It's one thing to send doctors there.
Right.
But it's another to make them want to stay.
Absolutely.
So what kind of incentives are we talking about here?
Well, think about things like scholarships tied to rural service.
Okay.
Or offering better pay and living conditions in those areas.
Yeah.
It's about creating an environment where they feel valued and supported.
So it's about making these rural postings desirable.
Exactly.
Not just a mandatory step in their career.
It shouldn't be a punishment.
Yeah. What about those PHCs and CHCs that we talked about earlier?
Yeah, they're crucial.
Yeah, it seems like they're so important.
They're absolutely vital.
For this whole system to work.
We can't just focus on attracting doctors.
Right.
We have to make sure those facilities can actually provide quality care.
So adequate staffing, reliable equipment.
Essential medicines.
Yeah.
Steady supply of
A
medicines.
steady power supply.
Oh, yeah, power is huge.
It's like building a house.
Yeah.
You need a solid foundation.
You need that foundation.
Those elements have to be there
Absolutely.
for everything else to work.
Right.
And I'm thinking back to those PPPs that we discussed.
Yeah.
Could those be a key part of, really strengthening
They could.
these rural healthcare facilities?
I think so.
Really?
Imagine the government working with private hospitals to upgrade those PHCs and CHCs.
Using their expertise and their resources.
Exactly. Bring in the technology.
Yeah. And it's not just limited to those traditional hospital models.
It's not.
We talked about mobile units, telemedicine,
Yeah.
AI, all these innovations.
Integrate them.
Even to the PPPs.
So it's about leveraging those innovations to reach people where they are.
Exactly.
Think about like a mobile unit equipped with telemedicine capabilities.
Right, there you go.
Yeah.
Taking specialized consultations to remote villages.
It's like taking the hospital to the patient's doorstep.
To their doorstep.
Now we can't forget about those underlying health challenges
Right.
that Chhattisgarh faces.
The burden of disease. Yeah. What are some of the priorities there?
We've got to ramp up those efforts
Right.
to tackle those major issues.
Okay.
Expand those outreach programs for maternal and child nutrition.
Okay.
Disease control programs for malaria and TB.
Yeah.
It's about addressing root causes.
Right. Not just treating symptoms. It's like we're weaving this safety net
Yeah,
to catch people before they fall through the cracks.
that's a great way to put it.
But what about taking things a step further?
Yeah.
We focused a lot on the government
Right.
and healthcare providers. But what about empowering those communities themselves
Yes.
to take charge of their own health?
That's such an important point.
Yeah.
Imagine training community health workers,
Okay.
people from those villages
Yeah.
who understand the local context.
Right. They speak the language.
Exactly.
They understand the customs.
They have the trust of the people.
Yeah. And they can provide that basic healthcare education and support.
Yeah. It's about tapping into that local knowledge.
Yeah. And building trust.
And empowering people.
Right. Giving them the tools
Yes.
to make informed decisions
Absolutely.
about their own health.
It's so important.
And let's not forget about traditional medicine.
Yeah, that's a great point.
While we need to make sure that those practices are safe.
Safe and effective.
Yeah. There's a lot of wisdom
There is.
in those traditional systems.
Absolutely.
So could we imagine integrating those practices
We can.
where it's appropriate and safe?
Into the overall healthcare system.
That would be amazing.
It's about respecting those traditions while also blending them with modern medicine.
a holistic approach.
Yeah, to create this truly holistic approach.
I love that.
We've talked a lot about treating illnesses,
Right.
but what about preventing them
Yeah, prevention is key.
in the first place?
We need to invest in prevention.
Yeah. Where does prevention fit into all of this?
I think it needs to be front and center.
Think about public awareness campaigns,
Okay.
educating people about healthy lifestyles, investing in clean water initiatives,
Yeah,
promoting sanitation and hygiene,
right. Especially in those rural areas.
particularly in
Right.
rural areas.
So it's about shifting the mindset from reactive care to proactive prevention.
Absolutely.
It's about creating a culture of well-being
I love that.
where people understand that health is an ongoing journey,
Yes.
not just something you worry about when you're sick.
It's a lifelong thing.
This has been an incredible deep dive.
It has.
I feel like we've covered so much ground.
We've just scratched the surface.
Right. But we've gone from the challenges
To the possibilities.
to the possibilities.
Yeah.
And, it's clear that there's no quick fix.
Not at all.
But there is this real sense of hope.
There is
It's
in
determination.
those efforts.
Yeah, that's driving all these different efforts.
I think it's important to remember that this isn't just about statistics and policies. This is about real people,
Real lives.
real lives being impacted.
And that brings us to our listeners.
Yeah.
We've explored this complex landscape together, but now we turn it over to you.
Absolutely.
What are your takeaways from this deep dive?
What resonated with you?
What resonated with you the most?
What innovative approaches do you think could make the biggest difference in Chhattisgarh?
Yeah.
How can technology, community involvement, and government policies all work together?
To create a healthier future for the state.
For everyone.
It's time to reflect, to share your thoughts, and maybe even to be inspired
Yes.
to take action.
Even small steps can make a difference.
Remember, even those small steps taken collectively
Absolutely.
can create a ripple effect,
It can.
leading to transformative change.
That's what we need.
Well, thank you for joining us on this deep dive
Thank you.
into Chhattisgarh's healthcare system.
It was a pleasure.
We hope it sparked your curiosity.
And maybe even ignited a passion.
To make a difference. Until next time, keep exploring, keep questioning,
Keep learning.
and keep learning.